Hello friends, welcome to Dental Digest Plus. Today's topic is mercury in dental amalgam. Please subscribe to my channel, and press the bell icon, so that you can get regular updates for the new videos. Mercury is a chemical element with symbol Hg, and an atomic number of 80. Mercury is the only metal that is liquid at room temperature. Mercury retains its globular form due to high surface tension. Mercury is available in three forms. Elemental mercury, which can be liquid or vapor. Inorganic compounds. And organic compounds. Elemental mercury are in two forms, liquid mercury and mercury vapor. Liquid mercury is absorbed relatively poorly across skin or mucosa, as compared to the mercury vapor. Most mercury becomes ionized before it reaches the blood. And this ionized mercury is excreted well through kidneys, and there is no known risk to patients from liquid mercury. Mercury vapor is rapidly absorbed into the blood via the lungs. It remains uncharged and therefore it is highly lipid soluble, for several minutes. Mercury vapor can cross the blood-brain barrier, where it becomes charged, and this charged mercury exists in extracellular fluid of the brain, and returns into the blood much more slowly. High tissue levels can lead to impaired brain function, insanity, and death may occur at 4,000 microgram per kilogram. Low tissue levels can lead to restlessness, tremors, and loss of concentration. Inorganic compounds of mercury. Source of the inorganic compounds are drinking water and food. Amalgam contains several different inorganic mercury compounds. They are of low or very low toxicity, and are apparently harmless when swallowed. They are poorly absorbed. They do not accumulate in body tissues and they are well excreted. Organic compounds of mercury. Source of the organic compounds are drinking water and food, like seafood. Some organic compounds of mercury are highly toxic at low concentrations. But none are known to form in the oral environment through dental amalgam use. Mercury release. Release of mercury vapor from said amalgam will be lower than that from liquid mercury. Mercury release is greater for low copper amalgams, because of corrosion-related loss of tin and increased porosity. Mercury release is greater from unpolished surfaces. Mercury release is increased by tooth brushing, which removes a passivating surface oxide film, although this reforms rapidly. Mercury vapor released. Small quantities of mercury vapor is released during all procedures, including amalgam mixing, setting, polishing, and removal of amalgam. Also during mastication and drinking hot beverages, small amount of mercury vapor is released. Release of the mercury vapor is correlated with the quantity of mercury used during trituration. If amalgam restoration is covered by saliva, it reduces the vapor pressure of mercury. Addition of indium up to the limit can decrease the vapor pressure. Concentration of mercury. The Occupational Safety and Health Administration has set a threshold limit value of 50 microgram per meter cube, as the maximum amount of mercury vapor allowed in the workplace. Average daily dose of mercury from dental amalgam, for patients with more than 12 restored surfaces has been estimated at up to 3 microgram. Mercury in urine. Body cannot retain metallic mercury, and it is excreted in urine. The peak levels of mercury in urine are twice as great when amalgam is removed, rather than during insertion. Dental personnel is reported to have more exposure to mercury, and their urine mercury level has 3 to 22 microgram per liter compared to the non-occupational group, which can be 1 to 5 microgram per liter. Neurological changes are not detected until urine level exceeds 500 microgram per liter, that is nearly 170 times the peak level found in amalgam insertion. Concentrations of mercury. Maximum allowable amount of mercury in blood is 3 microgram per liter. Freshly placed amalgam restorations can elevate the blood mercury levels to 1 to 2 microgram per liter. Mercury in blood is easily influenced by other factors, and cannot be explicitly related to amalgam. Mercury is normally present in amniotic fluid, and it increases with fish intake, and number of amalgam fillings. However, no adverse effects were observed throughout pregnancy and to the newborn. Lowest dose of mercury that elicits a toxic reaction is 3 to 7 microgram per kilogram of body weight. Paresthesia occurs when mercury exposure reaches 500 microgram per kilogram of body weight. Ataxia occurs when mercury exposure reaches 1000 microgram per kilogram of body weight. Joint pain occurs when mercury exposure reaches 2000 microgram per kilogram of body weight. Hearing loss and death occurs when mercury exposure reaches 4000 microgram per kilogram of body weight. Toxicokinetics of mercury. Elemental and inorganic mercury is poorly absorbed from gastrointestinal tract, and actively absorbed from lungs. As you can see into the diagram, elemental mercury is absorbed through the skin and lungs. Inorganic mercury is absorbed through the skin, lungs, and gastrointestinal tract. Organic mercury is absorbed through the lungs and gastrointestinal tract. From skin, lungs, and gastrointestinal tract, mercury goes into the blood. This mercury-containing blood circulates to the hair, nails, brain, and other sites. After that, mercury from the blood is excreted through urine and feces. Mercury-containing nails and hair exfoliates. Due to high lipid solubility of mercury, it penetrates the alveolar membranes and easily distributed to all tissues of the body. Oxidation of elemental mercury may also occur in the central nervous system, since oxidized mercury is unable to cross the blood-brain barrier and diffuse out of the brain. It results in the accumulation of mercury in the central nervous system. Mercury is tightly bound to sulfide groups in proteins, which represents the principal mode of action for its toxicity and is responsible for the slow elimination. Half-life of mercury is 20 to 90 days, and kidney contains the highest concentration of mercury following exposure to elemental mercury. Toxicity. If inhalation of elemental mercury in excess of 10 mg per meter cube occurs, there are chances of bronchitis and pneumonia in addition to central nervous system symptoms. Major manifestations of long-term mercury poisoning are tremors, increased excitability, and muscle tremors in fingers, eyelids, and lips, which can progress to chronic spasm of extremities. Early phase of toxicity is less specific, and referred to as micromercurialism. Clinical findings of micromercurialism includes tremors, enlargement of the thyroid with increased iodine intake by thyroid, tachycardia, gingivitis, and hematological changes. Sensitivity to amalgam restorations. Skin lesions are more common than oral lesions in case of the toxicity of amalgam restoration. Urticarial rash may appear on the face and limbs, and this may be followed by dermatitis. Long-term responses are oral lichen planus, or lichenoid reactions with erosive areas on the tongue, or buccal mucosa adjacent to an amalgam restoration. Amalgam tattoo is a gray, blue, or black area of discoloration on the mucous membranes of the mouth, typically on the gums of the lower jaw. It is an iatrogenic lesion, which is caused by entry of dental amalgam into the soft tissues. When the scraps of amalgam may fall into the open surgical or extraction wounds, there are chances of amalgam tattoo to occur. When excess amalgam may be left in the tissues, following sealing the apex of a root canal with a retrograde amalgam, there are chances of amalgam tattoo to occur. And when pieces of amalgam may be forced into the mucosa, there are chances of amalgam tattoo to occur. Systemic reactions. Minamata's disease is a neurological syndrome caused by severe mercury poisoning. It is methylmercury poisoning that occurred due to disposal into the nearby bay. Symptoms include ataxic gait, convulsions, numbness in mouth and limbs, constriction in visual field and difficulty in speaking, which is particularly unique to mercury poisoning. Alzheimer's disease is a chronic neurodegenerative disease that usually starts slowly and worsens over time. Inorganic mercury is neurotoxic at high doses, and is therefore suspected to play a role in the pathogenesis of neurodegenerative diseases like Alzheimer's disease. Multiple sclerosis is a demyelinating disease, in which the insulating covers of nerve cells in the brain and spinal cord are damaged. Evidences of association of amalgam and multiple sclerosis is not conclusive. Parkinson's disease is a long-term degenerative disorder of the central nervous system, that mainly affects the motor system. It is very difficult to establish a link with dental amalgam. Paresthesia and autism can also occur. Localized mucosal reactions can also be seen. Delayed reactions, in which tissue damage seen as contact mucositis, for example, intraoral diffuse red zones, blisters or ulcerations with pain, and burning sensation. The inflammation is not confined to exposure site. Contact dermatitis may be observed in the face or more distant locations, as urticarial reactions. Immediate reactions in which urticaria, asthmatic seizures, swelling of the mucosa of the throat and eyes can be seen, and it can even result in anaphylaxis. Monitoring mercury levels. Mercury vapor may be determined by using a mercury detection meter, such as mercury sniffer. Paper discs impregnated with palladium chloride can be used, but the major disadvantage is, it lacks reaction specificity. Dosimeter batch system may be used, in which mercury is adsorbed on gold foil. It is worn by the personnel in dental office to monitor the mercury level. Mercury in vapor and dust may be determined by passing the known volume of air through absorbing system, and then quantifying the absorbed mercury. Mercury Hygiene. American Dental Association recommendations. General recommendations are: train all the personnel involved in the handling of mercury and dental amalgam, regarding the potential hazards. Remove professional clothing before leaving the workplace. Working areas recommendations are: working areas must be well ventilated. The air conditioning filters should be replaced periodically. Floor coverings should be non-absorbent, seamless, and easy to clean. Do not use carpets. Periodically check the dental operatory for mercury vapor. Now let's see recommendations during preparation. Use only capsulate amalgam alloys. By using capsulate amalgam alloy we can prevent releasing of mercury vapor during trituration. Use amalgamator with hood, so that accidental mercury spill not occurs. Use care when handling amalgam. avoid skin contact with mercury or freshly mixed amalgam. Use high-volume evacuation systems, fitted with traps or filters, when finishing or removing amalgam. Salvage and store scrap amalgam in tightly closed container under radiographic fixer solution. When dispose amalgam scrap or waste, it should be done in accordance with the applicable law. Dispose mercury-contained items in sealed bags. Do not polish amalgam without adequate cooling water, as it has a very low melting point of 127 degrees centigrade. Similarly, do not remove amalgam without adequate cooling water. During amalgam removal, the surface temperature can increase several times when not used with adequate cooling water. So rubber dam, high volume evacuation, and water cooling can control this situation. Now let's see how to do management of mercury spills. In case of an accidental mercury spill, never use a vacuum cleaner to clean up the mercury. The vacuum cleaner will vaporize the mercury and drastically increase exposure in the area. Never wash mercury-contaminated items in a washing machine. Mercury can contaminate the sewage system and the washing machine. Never allow mercury to go down the drain. It can lodge in the plumbing, and contaminate the septic tank and sludge in sewage treatment plants. Never use a broom or a paintbrush to clean up the mercury. It breaks up the mercury droplets and moves them around, making it harder to decontaminate the area. Never allow people whose shoes may be contaminated with mercury to walk around. This increases the wearer's exposure and helps spread contamination. Never burn shoes, clothing, fabric, or anything that has been contaminated with mercury. This puts mercury into the atmosphere. A spill is considered small if there are less than 10 grams of mercury present. Small spills can be cleaned safely using commercially available mercury cleanup kits. Spill kits are essential for the management of mercury spills and breakages. These kits don't have to be very sophisticated or expensive. Each facility should have 2 or 3 mercury spill kits, and it should be replaced once it is used. Mercury spill kits need to be used by trained personnel to prevent further exposures, and each kit should have clean-up instructions that are specific to the hospital or facility. Contents of a mercury spill kit are 4 to 5 Ziploc type bags. Waste bags which are 2 to 6 mm thick. Plastic container with lid that seals. Nitrile gloves or latex gloves. Paper towels. Cardboard strips. Eyedropper or syringe without needle. Face mask. Duct tape or other sticky tape. Flashlight. Powdered sulfur or zinc which can easily be obtained at a pharmacy. And set of instructions with waste collection and disposal protocols. In event of small mercury spill, these are the steps that you have to follow. First step. Remove everyone from the area that has been contaminated, and shut the door. Turn off the interior ventilation system, to avoid dispersing mercury vapor throughout the facility. Step 2. In order to prevent breathing of mercury vapor, wear a protective face mask. Step 3. Change into old clothes and shoes, that can be discarded if they become contaminated. Step 4. Remove all the jewelry from hands and wrists, so that the mercury cannot amalgamate with the precious metals. Step 5. Put on rubber or latex gloves. If there are any broken pieces of glass or sharp objects, pick them up with care. Place all broken objects on a paper towel. Fold the paper towel and place in a Ziploc bag. Secure the bag and label it as containing items contaminated with mercury. Step 6. Wood, tile, and any other like surfaces can easily be cleaned. Carpet, curtains, or other such surfaces cannot be cleaned properly. These items should be disposed. Step 7. Locate all mercury beads, then carefully use the cardboard to gather them together. Use slow sweeping motions to prevent accidentally spreading the mercury. Small and hard-to-see beads can be located with the flashlight. Mercury can move a surprisingly long distance on hard and flat surfaces. Be sure to carefully inspect the entire room. Step 8. Use an eyedropper or syringe without a needle to draw up the mercury beads. Slowly and carefully transfer the mercury into an unbreakable plastic container with an airtight lid. Place the container in a Ziploc bag. Label the bag as containing items contaminated with mercury. After you remove larger beads, use sticky tape to collect smaller hard-to-see beads. Place the sticky tape in a Ziploc bag and secure. Powdered sulfur or zinc stains the mercury into a darker color and can make smaller beads easier to see. Be careful not to breathe the powder, as it can be mildly toxic. Step 9. Place all materials used during the cleanup, including gloves, into a leak-proof plastic bag or container. Seal and label it. Step 10. Contact your local hospital manager responsible for toxic cleanup and proper disposal, to ensure that all mercury-contaminated waste is now secured in labeled bags and is dealt with. Step 11. Keep the affected area ventilated to the outside with windows open and ventilation running for at least 24 hours after your successful cleanup. If sickness occurs, seek medical attention immediately. Cleanup of large mercury spills requires experienced environmental personnel.